You're over 40 and your knee started hurting. You go to the doctor and you know what they'll tell you? It's age. Cartilage wears out. Take anti-inflammatories and chondroprotectors, maybe hyaluronic acid injections. If it gets really bad, we'll think about surgery. That's the standard script played out in thousands of offices every day. And you know what? That's not the whole truth, not even half the truth. There are things nobody will tell you, not because it's a secret, but because it doesn't fit the conventional medical paradigm, doesn't make money for the healthcare system, and requires work from you, not just swallowing pills. I'm an orthopedic surgeon with 30 years of practice, and over these years, I understood something that completely changed my approach to treating knee pain after 40. What I'm about to tell you is based on thousands of cases, on latest research, ignored by mainstream medicine, and on personal experience because I'm also over 50 and I know about knee pain firsthand. First thing, nobody will tell you knee pain after 40 in most cases isn't about age. Yes, you heard right. It's not a normal part of aging. You just need to accept. I know 70-year-olds who run marathons without knee pain and know 40-year-olds who can't climb stairs. Difference isn't age. Difference is what happened to their body the previous 20 years. You see, what starts manifesting as knee pain after 40 isn't a sudden event. It's the culmination of 2 decades of a certain lifestyle. 20 years of sitting, 20 years of wrong movements, 20 years of weakening certain muscles and overstraining others, 20 years of low-grade inflammation from wrong nutrition. All this accumulates silently. And when you turn 40, 42, 45, boom, knee starts hurting. And everyone says, well, you're over 40. What do you expect? Here's what I want you to understand. Your knees don't have a built-in timer for 40 years. They're not programmed to start falling apart at a certain age. Cartilage can serve 80, 90 years under right conditions. But most people don't create these right conditions. They create a perfect storm for degeneration. Second thing they won't tell you, your knee pain likely isn't from the knee. Sounds strange, I know. But it's true in 70% of cases, pain is felt in the knee, but problem sources above or below, in hip, in foot, in lower back. Even in how you breathe, how you hold your head, how you move arms when walking. Knee is the middle joint in the chain. It's caught between hip and foot. If hip moves wrong due to weak glutes, knee compensates. If foot is unstable due to weak arch muscles, knee compensates. And this compensation over time overloads the knee, causes wrong load distribution, friction, inflammation, pain. But what do most doctors do? Look only at knee. Do knee MRI. See changes in knee and treat knee. But if problem is in hip or foot, treating knee won't help. It's like trying to fix a leaking roof by replacing carpet that got wet from water. You can replace carpets all you want, but until you fix the roof, problem will return. Third, and this is big connection between knee pain and hormonal changes after 40. This is almost never discussed, especially with men. Everyone knows women go through menopause and it affects joints. Estrogen decline leads to decreased collagen production, increased inflammation, bone density loss. But few say men also experience hormonal changes after 40. Testosterone starts declining about 1% yearly after 35. By 45, many men have testosterone levels significantly lower than in youth. And testosterone is critically important for maintaining muscle mass, bone density, tissue recovery. When it drops, muscles weaken faster, bones become less dense, joints get less protection. Plus, with age, both sexes develop increased insulin resistance, cells respond worse to insulin, blood sugar fluctuates more, inflammation in body intensifies, and chronic inflammation is enemy number one for joints. It literally corrodes cartilage, makes ligaments less elastic, slows recovery. But why don't doctors talk about this? Because solution requires comprehensive approach. Need to check hormonal status, maybe correct it, work on insulin resistance through nutrition and physical activity. It's long, it's complex, it requires involvement of endocrinologists, nutritionists, physical rehabilitation specialists, much easier to prescribe anti-inflammatory and send patient home. Fourth, role of visceral fat. After 40, metabolism slows. Most people start gaining weight, even if eating same as before. And this weight often deposits as visceral fat, fat around internal organs. You may not even look very overweight, but this internal fat is present. And here's what's important to understand. Visceral fat isn't just dead weight. It's active endocrine tissue that produces pro-inflammatory cytokines. These substances circulate throughout body, creating chronic systemic inflammation. And this inflammation hits joints, especially weight-bearing ones, knees, hips. Every extra kilogram of fat isn't just additional load on knees when walking. It's a source of chemicals actively destroying cartilage from inside. Studies show people with excess weight have elevated inflammation markers in blood, even if relatively active and healthy otherwise. Fifth, what nobody explains about chondroprotectors. Doctor prescribes glucosamine and chondroitin and says, take for 3 months, might help. Might? Know why they say might? Because evidence base for these drugs' effectiveness is extremely weak. Most quality studies show no significant difference between chondroprotectors and placebo, but the supplements industry is worth billions. People buy them for months and years, hoping they'll restore cartilage. Here's what you need to know. Adult cartilage has very limited restoration capacity. It has no blood supply, nourished only by diffusion from joint fluid, and no pill can magically restore worn cartilage. This doesn't mean these substances are completely useless. Maybe they have slight anti-inflammatory effect. Maybe they slightly help in synthesizing cartilage components, but presenting them as medicine that will cure your knees, that's not true. It gives people false hope and distracts from things that actually work. Sixth, critical role of sleep. Nobody asks patient with bad knees, how do you sleep? Yet it's one of most important factors. After 40 sleep, quality worsens in most people. Less deep sleep, more awakenings, less growth hormone production, which is produced precisely during deep sleep. And growth hormone is critically important for restoring all tissues, including cartilage and ligaments. When you don't get enough deep sleep, your body literally can't recover from daily micro damage. Every day, cartilage receives thousands of microtraumas from ordinary movements. And every night, if you sleep well, body repairs them. But if you sleep poorly, repair isn't completed. Damage accumulates and manifests as pain. Plus, lack of sleep raises cortisol and other stress hormones that increase inflammation and destroy collagen. It's a vicious circle. Knee pain interferes with sleep. Lack of sleep intensifies pain. Seventh, and this is possibly most important, after 40 critical change occurs in neuromuscular system. Connection between brain and muscles becomes less efficient. Certain muscles, especially stabilizers, start shutting off even if physically healthy. Brain simply stops activating them properly. This is called age-related neuromuscular disintegration. And it's a huge factor in developing joint pain. Muscles that should protect knee don't activate on time or don't activate strongly enough. Knee becomes unstable, receives wrong load, hurts, and here's what's critically important. This can be reversed. Neuroplasticity works at any age. You can retrain your brain to activate right muscles, but this requires specific exercises focusing not on strength, but neuromuscular control. Not just pumping quadriceps in gym, teaching brain to properly coordinate all muscles around joint. Eighth, truth about injections. They offer you corticosteroid or hyaluronic acid shots as solution. What they don't tell you, corticosteroids give temporary relief by suppressing inflammation, but they're toxic to cartilage. Repeated injections can accelerate joint degradation. Temporary solution creating long-term problems. Hyaluronic acid theoretically should improve joint lubrication. But studies show contradictory results. Help some, many not. Effect often doesn't exceed placebo, and it's expensive. Very expensive, and insurance companies and clinics earn millions from this. Ninth, connection between stress and knee pain. When you live in chronic stress, your body constantly in fight or flight mode, cortisol elevated, muscles tense, inflammation enhanced, and interestingly, pain perception intensifies. Same level of joint damage will feel more painful in stressed person than relaxed person. Moreover, chronic stress changes biomechanics. You move differently when tense. Muscle patterns change. Breathing becomes shallow. Posture worsens. All this creates additional joint load. And last, 10th, nobody tells you there's alternative to pills and shots. That most cases of knee pain after 40 can be significantly improved or completely resolved without medications and surgeries. But this requires time, effort, and comprehensive approach. Need to work with hormonal balance, improve sleep quality, reduce systemic inflammation through nutrition, removing sugar, processed foods, trans fats, adding anti-inflammatory foods, omega-3, antioxidants. Need to lose visceral fat through combination of proper nutrition and activity. Need to restore neuromuscular connection through specific exercises. Need to correct biomechanics of entire chain, foot, knee, hip, lower back. Need to manage stress through meditation, breathing practices, adequate rest. Is this difficult? Yes. Does this require lifestyle changes? Yes. But it works, really works. Doesn't mask symptoms, but eliminates causes, and result is long-term, not temporary. That's what nobody will tell you about knee pain after 40, because it doesn't fit 10-minute appointment, because it's not sold as a pill, because it requires you to be active participant in your healing, not passive consumer of medical services. But now you know. And knowledge is power. Power to change trajectory of your knee health. Power not to accept pain as inevitable part of age. Power to take control. Your knees can serve you another 40 years. Give them right conditions, and they'll thank you